And India has confirmed 7 cases of human meta-pneumo-virus or HMPV infections, while Union Health Ministry has assured the public that the situation is under control and that there is no risk of a COVID-19-like outbreak. Now the question is, should you be worried? My colleague Rahisha Sehgal brings you the details on this.
Now, the rise in cases in India comes amidst a surge in respiratory illnesses in China. There is currently no evidence that the outbreak is out of the ordinary or that a new respiratory virus or illness has emerged in China. The symptoms of HMPV are similar to those of flu and other respiratory infections. Let's take you through the symptoms of HMPV. Number 1, cough, fever, nasal congestion, shortness of breath. And in severe cases, it can also lead to bronchitis or even pneumonia. Now, HMPV can spread through secretions from sneezing and coughing, close personal contact, and touching objects that have the virus, and then touching the eyes, nose, or mouth. The virus has an incubation period of 3 to 5 days, and that poses a higher risk to certain groups, which includes younger children under the age of 5 and elderly, that's above the age of 65, and also individuals with weakened immune systems. So they are vulnerable to the spread of HMPV. There are currently no antivirals to treat HMPV, so treatment consists of providing supportive care to patients with moderate or severe symptoms in this case. Now, the Indian Council of Medical Research is monitoring the situation. The ministry has urged the citizens to follow a few steps. Number 1, cover mouth and nose while sneezing or coughing, washing hands with soap, and also avoiding crowded places. Meanwhile, the ministry has advised people to cover their mouth and nose, like I mentioned. Also use tissue paper when you're coughing and sneezing. Wash their hands with soap and water or any alcohol-based sanitizer. And also stay at home and limit contact if sick. And also drink plenty of water and eat nutritious food. So these are some do's to keep HMPV at bay. Further, the ministry has advised people against reusing tissue paper and handkerchief coming in close contact with sick people. Apart from that, frequently touching eyes, nose and mouth, spitting in public places, self-medicating without consulting the physician. So these are some don'ts to keep the HMPV at bay.